Welcome back, everybody. This is 2024, my firstborn political show. I know it's late. It's been about 6 weeks. 6 weeks off of doing something I've come to love so much every single Thursday night. We've had plenty of guests. This is, I think, about the 55th show. I forget. Jeremy would know exactly. I forget the exact number. But we have a great year planned. There's a bunch of guests that want to come on. We're going to talk about coastal resiliency, a bunch of different things, a lot of different folks from around. Tonight's guest is someone that I've had on previously, and Born Political is basically finding out who the person is, what they're about, and why they do what they do. So in advance, I'm going to let you know that he has already been here and done that. We're not going to talk about who he is and where he started out. We're going to talk about what he's doing now. I happen to work with him. And if you want to know more about Mike Doyle, who the guest is tonight, you can easily go back, Google the show, Born Political. You'll find all the episodes on YouTube, Twitch TV, and Jeremy Lyda will tell me that I'm messing it up, but there's a bunch of different ways you can find it on Spotify. You can listen to that episode if you're really interested. But tonight, we're going to talk about addiction, what's happening in our community, how we're working towards helping remedy it. We know we're never going to find the solve, but how we move forward. Mike Doyle, welcome to the show. How are you, Mike?
Good, Joe. Good to see you, man. Good to be back.
Oh, it's great. I was looking forward to having you back because we talked about your football days and all those things you did.
Yeah.
And now we're going to really concentrate on what you're doing because we had very little time last time to talk about the actual work that you're doing now.
It was funny because I just remember looking at the clock and we had like 5 minutes left. I'm like, we haven't talked about much other than getting together here. So
and we got brought together through my wife. She met you at a conference and really saw the value in what you brought to the table.
Yeah.
You started coming to Community Speaks Out meetings, and I think as quickly as we were hoping that you'd want to be a board member, you accepted and became a board member. And I think that it's been over a year now, right?
It was a year in December.
A year in December.
Yep.
See, that's me totally off the top of my head. I'm figuring stuff out.
Yeah, that's pretty good.
So a board member of Community Speaks Out. I think what I like best about our group is how there's so many different opinions and parents and people in addiction, and we come up with all these different answers that I don't think are common in all the other groups. And what you brought to the table was just this lifelong experience, and then being part of Reliance Health, which I really didn't know about them much before, and then to know, and we'll talk about what you guys are doing and what the plans are, but this group for the last 60 years or however long he has been there, the work they've been doing has been incredible.
Right, I think this year makes it 48. I want to say they've been around. It's 1976. So
48, okay.
48 years. I was going back because I knew it was 40 the first year I was there. So I was like, all right, I'm there 8 years this year. So it's they've been pretty much dug in like a tick in Norwich for the last 48 years and serving Eastern Connecticut. I think we serve somewhere in the neighborhood of about 1,500 people a year. And we're currently working with about that many. It's an organization where it's kind of like a one-stop shop for anything that you need as far as community support goes. We do have a community support program, which is for case management for people if they need help with obtaining benefits or budgeting or this. We're a community mental health organization where we work with homeless. We have an outreach to the homeless program. We have a few housing programs, like our supportive housing. We have some, DDS services for development.
How are people finding you? Is it just, I know actually word of mouth probably is always usually the best because everyone knows who you are up there.
Yeah.
But like if somebody moves new to the area and their experience in either a mental health crisis or even homelessness, they would just look
We're
you
a
up
referral through 211. So if somebody calls 211, they're going to get our information.
Yep.
Check a lot of boxes on that goes. I think one of the biggest areas that we've grown in over the past 7 or 8 years is our recovery area too. We actually had a program with 211 back at the beginning of our recovery coach program where if you were struggling with your recovery, you could call 211 and get hooked up with a recovery coach. Back then, where it was a direct referral, and if it was like during our business hours, it was like a live, almost like a hot referral right to them. So, and that kind of what spawned into our recovery coach program right now. And for people who aren't sure what a recovery coach is, our recovery coaches are people with lived experience, either their own recovery or working with people that have been in recovery, like in their family or their friends or something. But pretty much, and I'm thinking about it. Everybody that is on my staff right now is in recovery, including myself.
Yeah.
So we have that perspective on things there too, and it's kind of nice because it's not just talking the talk; you've walked the walk too.
Yeah. So 8 years you've been there, and you got to experience the most catastrophic jump in deaths that we ever. I say that we could have ever predicted. I think regular society and people that weren't keeping track and tabs of it were extremely shocked. I think everybody was surprised when you look at the numbers. 107,000 people in 2022 died of opiate addiction. The numbers are coming in for 2023. They're going to be higher. They're predicting 2024 to be even higher. When we first got into the addiction world because of our son, I think it was like 60,000 people died per year. And those were numbers that we couldn't stomach or live with.
Yeah.
And now, because I think it's become part of our fabric, it's just almost like gun violence.
Yeah.
The drug overdose death and the rate has become part of our a number we just plug in every year. And I don't think people are aware that this thing hasn't not only not stopped, but it's still a snowball. We think it got exacerbated by COVID actually, and there was a lot of siloed people that were struggling. But so for 8 years, you get into this, and I think when they hired, I knew they knew that they needed somebody to address the recovery side of it, but they probably didn't know how much they needed.
That's exactly right. It's funny, Joe, when you say that, because when I came in, we had a completely different idea of the direction that things were going in as far as recovery goes right now at the way that we addressed it at Reliance Health. And within a few months, I said to my boss, I was like, this isn't what I do. And it was trying to take more of a clinical approach to it, like a addiction counselor type of approach. And I said to him, like, this isn't what we do. That's about fixing stuff that, from the past. We're talking about right now. How are you staying sober today? How are you staying on track in your recovery today? That's more about what we do. So that's why we went down the peer recovery specialist side or the recovery coach side. And, we work with people every single day that, are in different stages of recovery. It could be, they used this morning, or, they have 25 or 26 years. I have a group that we do. Part of my my title there is Penobscot Place. That was the initial program for this. That's a day program for people in recovery that can come across to, and it's kind of like an all recovery meeting where people come in at various stages of recovery. Yeah. That's how it started, and it's branched out into the outreach program that we have right now, which, I have 3 recovery coaches working in the community right now, and I've worked for about 10.
And I want to speak quickly about when you talk about 3 recovery coaches, most people just say, oh, it's 3 people, that these are things that just happen. Every single thing is a fight, and I think as a legislator, I kind of learned how much the state actually leans on their nonprofits. Day in and day out, we closed the Norwich State Hospital as a state. We made conscious decisions to not fund mental health, largely because of cost. And I think it was billed as that there were groups like yours out there, and that we were going to supplement them, and we were going to make sure that we made you strong. I don't think that's not, at least, and I know in your opinion, not been lived up to be what it should be. And I know you appreciate, the funding that you get, and we say all these things on camera, but the reality is, magic wand. Like how many recovery coaches would you have on staff for New London County? You have 3 now. Magic wand, money's not an issue. Where are you
10
at?
to 12. I'd have 10 to 12 right now. If we were doing all of Eastern Connecticut, I definitely would have 10 to 12. I could put 5 right in Norwich right now, and they would be busy. I have, like I said, I have 3 right now that are trying to cover different areas. We do some work down here in Groton, primarily a lot of our stuff because our funding comes from Norwich. We do a lot of stuff in Norwich there, and that's where we're based, and that's the community that we know well. But we've gone around to different towns, East Lyme being one, and Groton definitely. We're doing a lot of stuff down here with you all here. But if we were to cover Eastern Connecticut, even just southeastern Connecticut.
So you're looking at, but so just to even put it in perspective, you have 3 and 12, and we know eventually, even if you had 12, you'd say, you know what, these guys are overworked.
I need 15,
So we know there is no magic wand in politics. There's no magic wand in funding. And a lot of it is trying to transfer numbers and metrics and how many people are affected. And what we found even almost impossible at Community Speaks Out, we're doing a better job now figuring out how many people we actually touched. But when even as simple as paying for a ticket for someone to go away, we count that one person. But with all the work we do in Community Speaks Out and all the meetings we have, I understand that really affected the mother, the father, the spouse, the kids, to be able to get that person away to recovery, it really is this ripple effect.
Yeah.
And when you concentrate on doing the right thing, really a lot of good things happen. But how do you put metrics? And that's probably more, you live in more of that life than we do. We're funded by private donors, and if we start getting in the public world, in the public grant world, we really have to keep track of that. But those are numbers that really don't translate on paper.
It's tough too, because, and I hope I don't make any of my funders mad or anything when I say this. A lot of times, you come to a crossroads where it's, okay, do I do what's right for this person, or I do what the grant says I have to?
Yeah.
You know, and sometimes you have handcuffs on that. It's been a lot better lately in the past few years on loosening up some of the, the strings attached to some of the grant money that comes in, requirements that you have to do in certain places. But at the end of the day, that's how you get paid. So there are certain boxes that need to be checked, unfortunately, But as far as, the funding goes, the hard part about it is that it's not always seen, that needs to increase too. And it's funny that you mentioned the North State Hospital when it closed, because that was actually Reliance Health's first mission for people that were transitioning out of the state hospital back into the community. That was where we started. And
it was a mountain of work, and it was I was physically on site working at the North State Hospital when they closed. Not as a state employee, but as a contractor we were working at Benesky Treatment Center. It was a hospital. It was a section that I think it housed probably 100 and something people. But once they closed it, I think if they knew how bad we were going to need it later, maybe they would have somehow figured out a way to keep it open. But it wasn't going to happen. The state, it's a huge super property that needed. It was like its own little city. But sometimes it makes me wonder. I mean, and I don't know what drove. Because every time before us, there were people that voted and approved and built and did things for society or against society, however you want to define it. But somehow they had that wherewithal to build an entire mini city for mental health, and I feel like we're so far away from that now. And I know we're trying to do it through nonprofits. And I know that institutionalizing people, it's been proven that people are better off if they're at home. But we haven't funded the better at home part. We haven't we haven't done those things properly. And I don't want to keep banging on it. I think our state does a job as well as any other in the country. But there's so much more to do.
Right. And I agree with that. Connecticut is very forward thinking when it comes to that. And we're usually at the front of changes and implementing changes that go on. The eastern part of the United States is really on top of that. Between Connecticut, Massachusetts, Rhode Island, we're always the first ones that are doing things. A lot of pioneering stuff. And what you're talking about too, rather than having a centralized solution, has become more of a fragmented solution. It's people will go here for this, people will go here for this, people will go here for this. And it has put a lot of pressure and onus on the nonprofits in the area, between us and their sound community and there's, SCAD and the different organizations that are around. When the state hospital closed in Norwich, those people were just sort of released into the community.
Yeah, it was open the gates and,
pretty much.
Here's a voucher or and it was everything. The solve was all temporary. People were going to hotels. It wasn't like this. Sometimes I paint this picture that they just opened the doors and people literally walked out Route 12. But that wasn't the case. But they arranged things that were all short term, short lived. And then, we're going to give you this amount of time to get better. And that doesn't really work. There's multiple funding sources. I don't want to stay on the state the whole time.
No, not at all.
Multiple funding sources. And one that you and I have both been, I know through Community Speaks Out, beneficiaries of, is the Opiate Settlement Fund. And a lot of people aren't aware that there's a lawsuit that was against Purdue Pharma and McKesson. A lot of multiple pharmacies were named in this lawsuit also. But there's this large fund now that was sued for and won by attorneys generals all over the country. Connecticut and Groton in particular got $130,000 this last year. The council decided and voted to give it all to Community Speaks Out. We don't have an agency here in Groton. We felt like it was the best use for the money, and so did the council. We have a new council and a new mayor. We're going to be approaching them again and asking them. But there's towns that are other than Groton that we want to make sure are getting the understanding of what this money's for. This is one of the grant. We call it. They started calling it a grant. It's not a grant. It's a lawsuit that does have an absolute. It has a wide-ranging ways that you can spend the money, which makes it easier for groups like ours to get it and to spend it and be effective in the community. We want to make sure that they're not getting doling out to people who aren't doing the right thing, but we also want to make sure it doesn't stay in the coffers of towns and not do anything.
Right.
So, me and you talked about doing a road show.
Yeah.
And we may need to, but
we're going to have to one of these days, I think.
I think so.
Yeah. And I think part of that too. That's a good point. That there are towns that just got this money that are like, well, what do we do with this? You know, we don't really have an answer for this. And one of the things that we've done at Reliance Health is that we've gone out to some of these towns and we said, hey, rather than, trying to reinvent the wheel, we have a wheel.
Grease the wheel.
Yeah, exactly. Maybe we're the squeaky wheel and we need a little, little grease to it. But truthfully, we just went out and we just said, hey, we have this. If this is something that you're interested in your, in your community, let us know. And we've had some pretty good reception from a couple of towns. I mentioned East Lyme. We went down and we talked to them not that long ago, and they were really, on board with everything that we were offering for them. And it's great because, it's not just us going out and doing outreach. There's a lot of education piece to it, the Narcan. In fact, the first time I think you ever met me, I was doing a Narcan training.
That's how you're the Narcan training.
Yeah, at Community Speaks Out. I came out and did that. And but we've done that in the community. I think just in Eastern Connecticut, I want to say that we trained over something like 260 people last year on Narcan, and that includes Congressman Joe Courtney's office, the Norwich Police Department, Community Speaks Out, a lot of different agencies around. City of Norwich employees, we've gone and we've done,
And it's easy training, right?
It really is, yeah.
It's not as intense as doing the first aid and CPR.
No, not at all.
And it's something that you can do quickly, and you're also protected, right? So I think a lot of people have, and my wife and I think board members between Linda and Liz and my mom even have gone to restaurants asking that they carry it. And some of the questions are, well, I don't want to be responsible. I'm not a medical doctor or this, and I'm not a medical doctor. I just play one on TV. But in reality, there really is very little risk of giving Narcan to somebody that didn't even need it. Even though I think the signs are usually very apparent. Like someone's in the bathrooms, out cold, and there's probably drugs on the ground. Right.
And I think part of that too is, and to go on one of the points that you said, there's a little risk. If it's not an opioid overdose, it's not going to do anything to that person. If they're having a breathing emergency or if they're having a cardiac emergency, if you give them the Narcan or the naloxone, it's not going to have any effect on them.
A negative effect.
Right. Or and if it's not an opioid, because it only works on opioids, it's not going to do anything, at all. If it's something else, then it's going to take something else to do that. But again, you're right. A lot of times when you get there, it's pretty apparent with what's going on. I've yet to be on a where we've had to Narcan somebody. We didn't know exactly what it was.
Inspector Clouseau is not needed on the case. No. You can guess.
Yeah.
And so I talked about ripples and when you pay for a ticket or you pay for sober living, how it doesn't affect just that one person. But when Mike came down and did a Narcan training, I think it was within a week that one of the Narcans that he handed to somebody and gave them training saved a life. And how many opportunities? When people think of, I mean, not to bring up guns or something, but we say, some people carry because one day they could, in a really bad situation, maybe stop a bank robbery or whatever they have. But when people are nervous about carrying Narcan, I think of if you have this in your pocket with 107,000 overdose deaths, and if you could probably time that times 10 of how many overdoses actually happen in America, so say there's 1 million overdoses, if you have that in your pocket, there's 1 million people that you personally may be able to save. And if you can do that, I mean, that's pretty powerful. And I know the one person that we trained down here a long time ago when we first got involved, the mom was able to save her own daughter with a Narcan that we gave her. And, for the people who are out there saying, well, why should we do it? And just absolutely remember that we're human beings first and we're here to protect each other when we can. But imagine that mom having the ability or even the training to be able to save her own daughter. And that's happened. How many times has that happened in this country in the last year? It's you can't count
more
them.
than you can count, yeah.
More than you can count.
And it's funny that you mentioned that too, because I was just thinking about and I know I'm bringing up Norwich a lot, but it's where I have a lot of tracking and a lot of numbers. In the city of Norwich, last year there were 125 total overdoses. That's not deaths, that's overdoses that first responders went to. And of those, 58, the people got it. 58 people, received Narcan or naloxone before the first responders arrived, and 57 of those people survived.
Wow.
So one fatality of that, and where I would like that to be 100%. That's pretty good, and that's a really good case right there for why you should have Narcan and why, if you have somebody around you, and you mentioned the ripple effect, it touches everybody and everything around the person in recovery that's in active addiction. Yeah. We saw that last night in our group support meeting. There are family members that just are beside themselves and they don't know what to do, and part of what recovery coaches do in organizations like ours, like Community Speaks Out, we touch those people and we get to those people and we try to get them the support that they need, because it's not just about the person that's in it, that's struggling with addiction. It's that family, because there was a person at the meeting last night who was absolutely at the end of her rope with what she could do with the individual that she was dealing with, and it's tough when it's your own kid. Where do you say no? And it's like, where do you draw that boundary? Because you know that you need to, but then you're like, okay, well, if I can't let them stay here, what happens when they do that? And
and we always talk about getting people involved, because I always go back to my wife and I and think, and even last night I think I mentioned it, because I always remind myself that I got involved with this addiction group and this work because it was brought to my door in a real meaningful way. When my son showed up and I got nervous that he was going to die, it all of a sudden became not this national epidemic that people were talking about on the news. It became my epidemic.
It was in your living room.
In my living room. And how do you get people involved ahead of time, like before your loved one's addicted? How do you? Because there's a lot of things that I think if I had gone to a couple of these meetings, and what interest would I have had going? Like, let's be honest. It's like, if there's a game on and I don't have addiction in my family and no issues, why would I show up to a Community Speaks Out meeting or go to a Reliance Health training on Narcan? None of those things normally happen, but I think it's important before it happens to you. And odds are, and I don't wish this on anybody, but if you're looking at just straight odds in this country with that many folks that are addicted, 25 million Americans are actually in recovery right now. I saw the statistic. That's a lot of people. That means that there's a lot of, and if you do the ripple effect, and 5 and 6 people know those people, you're talking 150 million. It's half the population. We all have someone that we know that maybe we could not just save with Narcan. I mean, it's the little things. Sometimes you're just saying, hey, I know what you're going through. I didn't realize what you're going through. I went to a group, and I think that's how we kind of reconnect our world. We need to get there. Yeah.
And it's absolutely that, where we've had conversations with different communities where they didn't. It happens behind closed doors. It's not going to happen to me. It's not going to happen to my family until it does. Yeah. And that's just it. And if I weren't myself an active, been in recovery now for almost 25 years, I wouldn't have any interest in it either. Like you said, it's like if there was a game on, I'd rather watch a game than go to a Narcan training. But it's one of those things that's in the community that's so important. I laugh because Tammy posted when she got her Narcan kit and everything that she open carries, with the Narcan.
That's
and
Tammy.
Yeah. And
Tammy's unapologetic.
No, and I love it, and I love that. And I'm like, I use that one all the time because I keep one on my bag, I keep one in my car, and if I don't have one within arm's reach, it's very, very rare, know. But
No, Tammy's great. She really does. She does walk the walk. When you think about, because even when she brought it up, we're going to go to the restaurants, we're going to ask all the people. I'm like, honey, the restaurant's going to be funny about it, and she's a steam train, and she's not going to listen. And in the end, the conversations that end up coming out of it are pretty deep. Like, there are owners of these restaurants. We've had not pushback, but people being concerned. But then there's been some people that were just like, yeah, we want more of it, and we want to make sure that people know that we have it, and we want to be part of the solution, not the problem. And I think the deeper, instead of people keyboard typing and poo-pooing on like people doing good work in the community, if they actually came to a meeting and listened and saw a mom crying in our meeting or a father just crying like beside himself, not knowing what to do, they would say, okay, what can I do to help? Instead of throwing these grenades from the internet.
Right, from behind their, behind their computer screen,
Yeah.
where it's nice and safe and warm.
Yeah.
One of the things too that you mentioned was kind of the apprehension of doing it. People were kind of like, a little antsy about, getting in trouble because, what if it doesn't go right, or what if they do it wrong? Remember, you're covered under the Good Samaritan law, in the state, and actually I believe it's federal.
Are they calling 911 first? Because the training changes all the time.
People ask
if
me,
you're listening to this and you're like, okay, what do I? Because you might have Narcan in your pocket right now.
So I got 6 guns on my side here. It's Narcan. When I do the Narcan training, people ask me, do I call 911 first, or do I do the Narcan first? And my answer is yes. So here's my thing. If you have to go and get the Narcan, call 911. If you've got the Narcan on you, start the 911 and start the Narcan, and then get 911. Because the
Narcan's literally seconds.
Yeah, it's literally it's nothing more than if you've ever used like Sinex or something in your if you had like a sinus infection or something and you use that so that you can breathe, it's the same type of thing. Yep. You just put it in until you feel flesh on on your fingers and press the plunger down.
Yeah, and everything requires training because it sounds that easy.
Yeah.
But there are little things what to expect when the person wakes up, when putting them on their side, make sure they're not vomiting, and there's other things that go part of the training. But the reality is, if for some reason we have parents now that pick it up at the pharmacy because you can get it.
Yeah.
If you haven't, and you're listening to this video, it may be daunting, but you could Google it and watch a video.
Yeah.
On top of that.
Yeah, exactly.
But it's good to do it around people.
Right. And it's great because we're talking about this right now. If anybody is interested in doing that, they can contact you. They can contact me, and I could do a one-on-one training with somebody and give them some Narcan. They could come to Community Speaks Out, and we could talk to them a little bit about it and give them some Narcan there. So there's Narcan available, let's put it that way, and we can get it to people. It's one of the things that I think is really cool about having an outreach recovery coach program is that we can bring the Narcan out to people. We got 500 Narcan kits out into the community last year.
Yeah, and if you're watching this and you have a loved one that's incarcerated and about to get out, that's extremely vulnerable, and you're going to want to learn how to use it. They're coming back from a rehab facility, and they're coming back to the area here where they've used. Make sure that you get Narcan, that you figure it out. If you need the training, definitely reach out to us because we'll definitely want to. I can even train you. I'm not certified though, so we're gonna make sure that Mike does that training.
I think you'd be fine with it.
You've
seen it enough times now to where you get it, But truly, don't hesitate. And it's like if it feels like that you've got a need for it by somebody in your family, or even somebody that lives in your building, or somebody like that's a neighbor or something that you kind of suspect might be doing this. And you hit on a really important point though, and that's people coming out of incarceration or coming out of like treatment or something.
They got to be ready.
Because their tolerance is so low.
Not trying to scare the people coming out, but we're down on our last 15 seconds here. I want to thank Mike for coming out on the show his second time. It was great to actually have this conversation. I think it's a well-needed one. We have a lot of stuff coming up this year. Mike will be back. I want to wish Jennifer Jadukowicz well. Yeah. She's the director of SCAD, and she had a flu tonight. She was going to join us. Otherwise, it would have been. But we take up all the air out of the room anyway. That's what we do here. Born Political, we will see you next Thursday. Thank you for tuning in. Happy New Year, you guys. We'll see you next time.